by the private security contractor Blackwater was still being paid for work overseas. And those are some of the headlines. This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Anjali Kamath.
Welcome, everyone. We begin today with the continuing debate on health care reform. The White House indicated this weekend that it might be willing to drop proposals for a public insurance plan to compete with the private sector. Health and Human Services Secretary Kathleen Sebelius said Sunday on CNN that the public option was, quote, not the essential element of comprehensive reform. White House Press Secretary Robert Gibbs also hinted as much when he told CBS's Face the Nation that the president, quote, will be satisfied if they could come up with a plan that provided choice and competition in the insurance market outside of a government plan option. Their comments came one day after President Obama's own response at a healthcare forum in Colorado. He said, quote, the public option, whether we have it or don't have it, is not the entirety of healthcare reform.
As the White House seems to be willing to back off public option, as considering North Dakota Democratic Senator Ken Conrad's proposal for a nonprofit health cooperative, we take a look at what's really shaping the health care debate behind the scenes. In a cover story for BusinessWeek earlier this month, reporters Chad Terhune and Keith Epstein argue UnitedHealth and other insurers maneuvered to shape health care reform for their own benefit. The story is called "The Health Insurers Have Already Won." The authors argue the insurers have, quote, succeeded in redefining the terms of the reform debate to such a degree that no matter what specifics emerge in the voluminous bill Congress may send to President Obama this fall, the insurance industry will emerge more profitable. Well, we're joined on the phone from Florida by co-author of the piece, Chad Terhune, senior writer at BusinessWeek, where he's covered health care for several years. Welcome to Democracy Now!, Chad. Explain first why you believe, no matter what option is presented, no matter what the bill is, the health insurers have won.
First, thanks for having me on. I think if you look back earlier in the year, there was a lot of gloom and doom for the insurance industry, a lot of harsh rhetoric from both the president and Congress. But if you look, even by midsummer, you could get a pretty good picture of what was going to come in a final bill. And as you just noticed, we're kind of getting clear confirmation that there's not going to be a public plan. And I could have told you that from my reporting earlier in the summer. Just was not going to happen. And I think if you look from an insurance company's point of view, public plan was the worst thing they wanted to avoid. They do not want to compete against the government, so they can check that off. And then two, things like the minimum benefits. What coverage will everyone have to buy? They don't want that to be a expansive, generous list of benefits. They want to whittle that down to where you and I would have to pay more out of pocket. Insurance would cover less. They've been very persuasive on that, knocking down that number of what the minimum benefits would be. And then there's other things like you look at all the positives. They're going to get millions of new customers armed with generous government subsidies. That's a lot more paying customers. And things like that, and all the wellness programs and preventive care that Obama and everybody talk about, well, the insurers offer a lot of that. And you're going to have expanded Medicaid. UnitedHealth is the biggest Medicaid contractor. The states contract that out and pay people like United to administer that. So when you add it all up, that's kind of where we got with our story that, this is a big plus for the insurance industries, and particularly a giant like UnitedHealth.
Chad, can you talk about the kind of data and information that insurers like UnitedHealth provide to congressional staffers?
Yeah, so there's kind of two examples. One, United, probably more so than the other companies, said, look, how can we kind of break through the clutter? How can we grab the attention of these congressional members? And specifically, we're talking about moderate Democrats. These would be the swing votes on anything going through Congress. So they focus most of their efforts on the blue dogs in the House, and then the moderate Democrats in the Senate, like Kent Conrad, Mark Warner, people like that, who would be sympathetic to views of business. And the big thing in Congress is how are we going to pay for this trillion-dollar health reform, and particularly the blue dogs and the fiscal conservatives. They worry about the deficit, how much things cost. And so United said, well, look, we can be an expert on this. We can give you these long, lengthy reports on how to save billions of dollars in Medicare and other federal health savings, so you can then turn around and say, look, we're paying for this expensive health reform. Not exactly pushing United's pet issues, but it gets them in the door, and they're seen much more as a force for a solution instead of just opposing everything. And I think that was very key to be coming across as having expertise and knowledge, and kind of this idea we are the Department of day-to-day reality. You in Washington don't really understand complicated health care. We do, so you should sit down and listen to us. And then on a secondary phase, more of a directly in their benefit, they would come in with numbers of, okay, if you say these are the minimum benefits, these are the package, and it comes with an actuarial figure. That's basically a percentage of how much the insurance company pays on average and how much you and I as consumers would pay out of pocket. And at one point it was about 76%, meaning that's the percentage the insurance company would pay, and we would pay the rest in co-pays, deductibles, out of pocket. And over time, through the Senate Finance Committee, that's gotten whittled down to about 65%. And that's still subject to change, but the fear is that people could have coverage, there'll be mandates for coverage, everybody goes and buys some, but you still really could be exposed to medical bankruptcy. I mean, that's a lot of money if you still had to pay, $10,000 out of pocket after a major accident or illness. Not a lot of people have that money laying around.
We're talking to BusinessWeek's Chad Terhune. I wanted to play for you a clip from yesterday's one of its talk shows. Republican Senator Orrin Hatch of Utah was on ABC's This Week on Sunday. Like many in the Senate who are critical of a public option, the figures he cited were from the Lewin Group on two occasions when the substitute host, Jake Tapper, disclosed that the Lewin Group is owned by UnitedHealth.
They want to move, according to the Lewin Group, up to 119 million people into Medicaid. If that happens, it would destroy the health insurance programs throughout the country. 8 of 10 Americans really want their health insurance coverage. They don't want to lose it. If we turn over this country's health care to a government plan, and we open up a government plan, the Lewin Group, one of the best analytical groups in health care in the country, if not the best, said that up to 119.1 million people would transfer from private insurance into the government plan.
Well, Senator Hatch, we should point out, first of all, the Lewin Group is owned by UnitedHealthcare, although they insist
fine, but they're still highly respected.
Yeah, I'm not disputing that. But let me ask you a question.
So that's a clip from This Week on ABC yesterday. That was Senator Orrin Hatch. Chad Terhune, talk about the Lewin Group, cited over and over again by the opponents of the public plan. They don't say who funds it. They just say, according to the Lewin Group, a well-respected group.
No, it's a good question. The Lewin Group has been around for many, many years. UnitedHealth bought it in the last few years. They have done work for both Democrats and Republicans over the years, and generally get hired by people like the Heritage Foundation, but they've also done some work with more liberal-leaning groups, and they have been around for a long time. They have many smart people, but the fact that they are owned by UnitedHealthcare, and this is kind of going back many years, UnitedHealth, more than just an insurance company, has expanded much more into kind of the knowledge and data and software business. Kind of controlling information is very key in healthcare. Yes, they say that there are two separate organizations, and the people at Lewin Group say they can call it like they see it. But it is very, even to me, surprising how much one group's analysis has come to dominate the debate. And yes, many opponents of a public plan, both Democrats and Republicans, have latched on to their numbers. And I'm a little surprised Senator Hatch would still use the 119 number, because I think that is from April, and that was actually based on proposals made in the campaign going all the way back to October of 2008. And the latest number from Lewin Group, while still high, is more like 88 million people, they predict. So, even 119 is kind of an outdated number. But the nonpartisan Congressional Budget Office, which I think more people put some stock in, they've had a number of total that would go into a public plan would be 9 to 10 million. And they have even publicly, in one of their letters to Congress, said the Lewin Group number is just way out of the ballpark. So, people can certainly take whatever they want to take from those various numbers, and these are projections, but the CBO certainly differed with the Lewin Group.